Introduction. Welcome to today's lecture on pancreatic islet transplantation. In this comprehensive session, we will delve into the intricate workings of the pancreas, the pathophysiology of type 1 diabetes, the immune response to islet transplantation, and the various aspects of this innovative procedure. We will also explore the principles of immunosuppressive therapy, donor selection criteria, isolation and purification techniques, recipient evaluation and preparation, transplantation methods, monitoring of islet function, management of complications, alternative approaches, and the current challenges and future directions in the field. So, let's kickstart our journey into the fascinating world of pancreatic islet transplantation. To comprehend the process of islet transplantation, we must first thoroughly understand the anatomy and physiology of the pancreas. The pancreas is a vital organ situated in the upper abdomen, and it plays a pivotal role in maintaining glucose homeostasis within the body. Composed of both exocrine and endocrine components, the pancreas harbors specialized regions called the islets of Langerhans. These islets consist of several types of cells, including alpha, beta, delta, and gamma cells, each secreting distinct hormones involved in glucose regulation. The beta cells, specifically, produce insulin, the hormone crucial for lowering blood sugar levels. It is imperative for future physicians to grasp the fine intricacies of the pancreatic structure and its functional significance before engaging in islet transplantation. Now that we have familiarized ourselves with the anatomy and physiology of the pancreas, let's shift our focus to type 1 diabetes and its effect on pancreatic islets. Type 1 diabetes, also known as insulin-dependent diabetes mellitus, IDDM, is an autoimmune disease characterized by the destruction of beta cells, leading to a deficiency of insulin production. This disruption in glucose regulation can result in severe complications if left untreated. Understanding the underlying pathophysiological mechanisms behind type 1 diabetes is essential for comprehending the rationale behind islet transplantation as a potential therapeutic option. It is crucial for medical practitioners to grasp the intricate interplay between the immune system and the pancreatic islets in order to provide optimal care for patients with type 1 diabetes. Moving forward, we must explore the immune response to islet transplantation and the potential complications that may arise. When islets are transplanted into a recipient, the immune system recognizes these foreign cells and initiates an immune response. This response can manifest as rejection, which can be either hyperacute, acute, or chronic. Hyperacute rejection occurs immediately following transplantation, mediated by pre-existing antibodies within the recipient. On the other hand, acute rejection typically happens within the first few weeks, while chronic rejection may develop over an extended period. Recognizing and managing these potential complications is crucial for ensuring the long-term success of islet transplantation procedures. In order to mitigate the immune response and prevent rejection, various principles of immunosuppressive therapy are employed during islet transplantation. These principles involve the use of medications that modify or suppress the immune system's response. The specific medications utilized include calcineurin inhibitors, mammalian target of rapamycin, mTOR inhibitors, and corticosteroids. Combining these agents in a tailored immunosuppressive regimen is vital in enabling successful islet engraftment. However, striking a delicate balance between preventing rejection and avoiding drug-associated complications is a constant challenge in clinical practice. To ensure optimal outcomes, stringent donor selection criteria and meticulous procurement procedures are crucial in the field of islet transplantation. Donors must undergo a comprehensive evaluation to assess their suitability for pancreas donation. Factors considered include age, medical history, cause of death, and organ function. The procurement procedure involves surgical removal of the pancreas, followed by specific isolation techniques to collect and purify the islets. Implementing standardized protocols for donor selection and procurement is essential for obtaining high-quality islets for transplantation. In our pursuit of successful islet transplantation, we must delve into the intricacies of islet isolation and purification techniques. After the pancreas has been procured, the islets need to be meticulously isolated and purified to remove residual exocrine tissue and other contaminants. This process, typically performed in a laboratory setting, involves enzymatic digestion, density gradient separation, and selective purification methods. Understanding these intricate techniques and their associated challenges is vital for enhancing the viability and functionality of the isolated islets, thereby improving transplantation outcomes. In preparation for islet transplantation, recipients must undergo comprehensive evaluation and preparation to ensure optimal outcomes. A thorough review of the recipient's medical history, including past surgeries, comorbidities, immunological status, and psychosocial assessment, is imperative. Additionally, screening for potential contraindications and optimizing the recipient's medical condition plays a crucial role in the overall success of the transplantation. Collaborative efforts between various healthcare disciplines are required for a holistic approach to recipient evaluation and preparation. When it comes to implementing islet transplantation, several techniques and methods are available, including percutaneous and surgical approaches. Percutaneous transplantation involves the infusion of isolated islets into the portal vein through minimally invasive procedures such as the percutaneous transhepatic route. Surgical transplantation, on the other hand, involves open surgical access to the liver or the use of portals to deliver the islets directly. Understanding the advantages, disadvantages, and patient-specific factors associated with each technique is crucial for making informed decisions and ensuring successful transplantation. To gauge the success of islet transplantation and monitor islet function post-transplant, specific assessments and monitoring techniques are employed. These include measuring blood glucose levels, monitoring levels of C-peptide and glycated hemoglobin, HbA1c, conducting glucose tolerance tests, and utilizing imaging modalities such as ultrasound and MRI. These evaluations aid in assessing functional graft survival, optimizing insulin independence, and detecting potential complications promptly. Thorough and consistent monitoring is vital for long-term graft viability and patient satisfaction. Complications may arise following islet transplantation, and effective management strategies must be implemented to address these issues. Complications can include immune-mediated rejection, graft dysfunction, infection, metabolic abnormalities, and late-onset complications such as cardiovascular disease and renal impairment. Proper long-term follow-up care is paramount for monitoring and managing these complications promptly, ensuring the graft's longevity, and enhancing overall patient outcomes. Despite the advances in islet transplantation, alternative approaches, such as stem cell therapy, have emerged as potential avenues in the field of diabetes management. These approaches involve utilizing the potential of stem cells to differentiate into functional beta cells. Stem cell therapy holds promise in overcoming the limitations associated with islet transplantation, such as the scarcity of donor pancreases and immune rejection. Exploring these cutting-edge techniques and their potential clinical applications is crucial in expanding the horizons of diabetes treatment. As with any rapidly evolving field, pancreatic islet transplantation faces numerous challenges and constantly strives for innovation. Current challenges include improving long-term graft survival, minimizing the adverse effects of immunosuppressive therapy, expanding donor availability, enhancing transplant outcomes for patients with type 2 diabetes, and exploring novel approaches such as gene editing and tissue engineering. Studying the current challenges and remaining vigilant towards future directions is essential for advancing the field of pancreatic islet transplantation to new horizons. In conclusion, pancreatic islet transplantation represents a remarkable breakthrough in the management of type 1 diabetes. By gaining in-depth knowledge about the intricate anatomy and physiology of the pancreas, understanding the pathophysiology of type 1 diabetes, unraveling the intricacies of the immune response to islet transplantation, and exploring the various aspects associated with this procedure, medical practitioners can provide comprehensive care to patients. As we move forward, interdisciplinary collaborations, further research, and technological advancements will unlock new doors to overcome existing challenges and pave the way for the future of islet transplantation. So, let us continue our journey, eager to embrace the evolving frontiers of pancreatic islet transplantation.